first and foremost, understanding the person for who the person is, their behaviors within the context of their own experience, their own history, their own culture, their own intersectionality of identities has to be understood before we're even thinking about diagnosis. And I think it's a big flaw that a lot of clinicians have, is we're going in really diagnosis heavy. And first we need to understand that person. And our diagnostic system is flawed anyway. We don't have the opportunities for complex trauma diagnoses. We don't have the opportunity to highlight the complexity of the person outside of a categorical label. And in some ways, we need that. In some ways, especially in the place that our society is right now, we can't do without it. But we as clinicians need to know the limitations of that. Because each one of us, I was going to say the people we work with, but the reality is each one of us is very complex. And the more complexity that we're bringing to the picture, the less we're going to be able to take a simple response. And again, that is a function of our society, that we want to be able to get an answer. We want to be able to take a pill. We want to be able to have the solution that's going to fix something. And the complexity of our human nature doesn't allow for that. Consider your lens. If we are only having an autism lens, and absolutely for myself, if I'm only having a trauma lens, everything starts to look like trauma. Everything starts to look like autism. An example would be people with autism traits may have poorly differentiated emotional responses. They may be harder to soothe once aroused. They may have trouble regulating negative affect. That's true for trauma too. So if I'm looking at that from a trauma perspective, I might be like, great, I understand what's happening here. But taking a step back and remembering the bubble that we live in. Diagnostic overshadowing is when somebody comes in maybe to the office with an autism diagnosis already, and therefore all the behaviors that the person is displaying is interpreted as autism behaviors, and we're forgetting that there could be other possibilities going on. We're forgetting to even evaluate for trauma. We're forgetting to consider that ADHD might be influencing those behaviors. So diagnostic overshadowing can be a challenge for us to keep in mind as well. And then finally, research is flawed. The lack of inclusion of people with autism in trauma studies and vice versa makes our research really limited.